Who was that?
That's my fiance. Sorry, he's talking to the dogs.
Oh, that's okay.
Got nobody else to talk to.
That's probably true. Okay, I'm going to continue to eat my dinner while I wait for everybody to get on.
What are you having for dinner?
Chick-fil-A, or no, Slim Chickens. Okay, I'm still waiting on quite a few people to get on. I know there are 2 juniors who will not be attending probably. Does anyone know of anyone else?
Hey, Dr. Wheeler.
Hey.
Do you know Dr. Chavez in Siloam Springs?
No. What practice?
I think he's the one that's over. He's the one that took over Dr. Walters' office.
Oh, okay. No, I have not met him.
That's the one that was hiring.
Okay.
Montana, is that still called Siloam Smiles?
Yeah.
Okay, we're still missing quite a few people. Okay, I'm going to go ahead and get started because it's almost 6:15. We're still missing probably about 7 or 8 people, but hopefully they'll catch up. Turn on your cameras, please. Okay. Mallory, did you see my message?
Yes, your email? Yes.
Okay. And Shelby, you received my email.
Yes.
Okay. And what about Henderson and her group? Did you receive?
That's the same group.
Okay, okay.
Yeah.
I didn't get an email.
I'll send it to y'all. I'll send it to you.
I think I sent it back to whoever sent me and Jackie, I sent you a message back.
Yes, ma'am, I got it.
Okay, had you looked into that?
Not very much. I was gonna do a little bit more research about that this weekend to see if there's something I can like tie it into.
I was just curious. I don't know if there is anything. All right, so tonight is Amnesty Night. And for Amnesty Night, you get to break up into groups and form some things that you want clarification about or you have questions about. But I do want to talk to Aspen for just a minute.
Yes.
Aspen, we have our conversation yesterday. I gave you some bad intel on, we were talking about cardiac conditions that are indicated for pre-med. And I told you I had that slide and I tried to get it to go, but it didn't send to my computer. So I'm going to have to try to send it again so you can put it on your phones. At least I would advise you to put it on your phones because it's handy information to have when you're at the chair. The other thing is that although pacemakers, I don't think are specifically mentioned on that, although the device itself sits just below the skin, it does have leads that go into the heart. So most of the time, you will probably at least do a consult with the physician to see if you need to pre-med that. Does that clear it up a little bit?
Yes, thank you.
Okay. And Tarnell, wherever you are, you're right. That one question in chapter 36 does not have the right answer. It was 60 million people have hypertension in the US. So I think that's a miscue in the book. Okay, so are you clear on that?
Yes, ma'am.
Okay, because we're going to talk about another question that's in this chapter. I'm waiting to see what Madison has sent me.
I just sent you the picture of the slide for the pre-med.
Can you send that out to the juniors?
Yes, I can.
It does, because we were talking about having a pacemaker implanted versus a transplant. They are two different things, but it's quite possible that if you have a transplant that develops problems, you will need to do pre-med. And if you have a pacemaker that is implanted with leads into the heart, you will probably need to pre-med too. So what we're going to do tonight is we're going to go into breakout rooms. And these are rooms composed of both juniors and seniors. And this is for you to chat with each other and kind of talk about what needs to be clarified, I guess what you're worried about. I did go back and look at my test questions, and I have one test question about medications, and it's from this chapter that we're getting ready to discuss. But if you need clarification about cardiovascular or special needs in general, I want to address that tonight. So I'm going to open these breakout rooms. I want you to go in, spend about 10 minutes, chat, and then come back to me with what you discovered. And seniors, I'm going to let you be responsible for introducing it, since I think the juniors are still a little wary. Okay? So this is your time to be advocates for them. All right, here we go. Lindsay, do you not have an assignment yet?
What do you mean?
You should have gotten a message that the room.
No, you didn't put me in any room.
Okay, I thought it did. I'm gonna put you in one right now. Okay, you should have gone to group 1. There you go. Yeah, yeah.
Dr. Wheeler.
Yep.
I think I got kicked out of my room. I guess. I don't know. It all of a sudden was like buffering and then it just I was in 6
Go look.
with Jason, Kelsey, Zandy.
I'm gonna. Okay, and you're in room 6. All right.
Yeah, my Wi-Fi's kind of acting crazy, so I don't know. It keeps kicking me out.
It doesn't give me a chance to put you back in.
Well, I text Kelsey to see if they got kicked out of it, and she said they're still in it. So I don't know what's going on. Maybe it's my internet.
It might be. I'm gonna put you in a different room.
Okay.
Don't you love technology?
Showing us all your tricks.
What?
You're showing us all your new tricks.
Just learning on the fly. Okay, I think everybody should be back about 10 seconds. All right. What do you have for me?
Our group, we went back over the needs for pre-med,
Yes.
just to make sure that especially to make sure the juniors understood what those conditions actually were. Because last semester, several of us just kind of just memorized a list,
Right.
didn't know what they were, but now we understand what they are, so they make more sense.
Okay. And do you understand the reasoning behind the pacemaker has leads into the heart? Okay. All right. So at the very least, you're going to do a consult to see. If you're not sure, you always want to do a consult. Sometimes you just don't know. And there's lots of weird conditions, like a patient waiting for a liver transplant and they want them on antibiotics, and patients waiting for a kidney transplant, they don't want them on antibiotics. And those are specialized cases, so it's always best to ask if you don't know. All right. Specifically, anything else, Katie or any other person in the group? Nobody?
We went over the case study and we had a few questions about that, but I didn't know if you wanted us to go over
We're going to talk
that
about
yet or not.
and then I just kind of wanted to get a general idea So I'm just going to kind of recap respiratory disease. Well, the problem with respiratory disease, when we cannot oxygenate ourselves fully, we may have decreased defenses against pathogens. And so our goal is to try to reduce bacteria. Also to reduce stress. We want to watch out with aerosols because aerosols move everywhere. And we have found out with the COVID virus, we may have to set the patient up in an upright or semi-upright position. There is a difference between upper respiratory infection and lower respiratory infection. An upper respiratory infection involves the flu, the common cold, and strep throat. Now, lower respiratory infections involve bronchitis and pneumonia. Okay, so that's going to be further down into the tract. Everybody understand that? And so patients who have respiratory conditions are at an increased risk of having problems if they have perio, because that just creates more pathogens that they can potentially breathe in. And as we've seen with the COVID virus, should that virus get into your lungs and start destroying some of the tissue, you will have a problem. Even if you have good blood flow to the organs, you will have a problem with gas exchange because there's so much damage to the alveoli that they can't swap out carbon dioxide with oxygen. Does anybody understand that pretty well? Okay. Now, the asthma is classified by how severe it is, and it's either extrinsic, which means it's caused by allergies, or it's intrinsic, where it's caused by stress. It can be exercise induced. There's a lot of different factors listed in your book. It's on page 614, and these patients often have a compromised, what they call forced expiratory volume. They're not able to force the air out of their lungs as well as they used to. And it's a problem if it starts falling below 80%. So these are things you want to ask the physician and know something about. They are going to be considered compromised. Okay? And then we have COPD, which is chronic obstructive pulmonary disease. That can include chronic bronchitis, and bronchitis causes scarring. We'll have less efficient lungs. We can have emphysema, where the patient, and it talks in your book about the difference between a blue bloater, which is the bronchitis patient, and a pink puffer, which is the emphysema patient. So the blue bloaters will not be as, their color will be off. They won't be as well oxygenated. The pink puffers will be pretty well oxygenated. They just can't exchange the carbon dioxide off. Okay. All right. You want these patients to stop smoking, set them up in a semi-supine position, and if they have less than 91% pulse oximeters, or a rating percentage on the pulse oximeter, which is a device that goes over your finger, you snap it on, and it tells you pretty quickly what your blood oxygen levels are. And most of us should be hovering at 99 or 100%. Now, if you're below 91%, you may need supplemental oxygen. So I want you to keep all those factors in line. I also want you to be familiar with the TB guidelines. And juniors, I mentioned that I wanted you to know medications for asthma. So there's a page I want you to look at. It's 614, and it talks about some of the medications used for asthma, and this will get more detailed in pharmacology. But if you can kind of get a brief idea, it talks about a short-acting bronchodilator, a long-acting, which is inhaled bronchodilator, and the short-acting is also inhaled, a controlled, a corticosteroid that is inhaled, and an oral corticosteroid, and then some sort of oral medication to be a monoleucous or leukotriene modulator. In this book, it calls it an anti-leukotriene. Kayla, your eyes just got real big. Are you okay? All right. So how are we on the basics of problems that people can have with respiratory conditions?
Basics, good. Anything further than that? No.
Okay. Your book gives a pretty good, I did want to emphasize one other thing for juniors. The very first thing to happen is in asthma is what, seniors?
Inflammation.
Then what follows?
Obstruction.
Yes, bronchoconstriction. So, okay, so you get this mucus buildup from the inflammation in your lungs. And in response to that, your bronchioles constrict, try to get more air, and it just is not working. Okay, that may sound kind of counterintuitive, but I do want you to understand the very first thing that happens in asthma is inflammation. And there's a good picture of it on your that page 614. Okay. All right. Can you think of anything else you want to ask me about these two chapters?
I have a question that's unrelated. Why do you have a Band-Aid on your forehead?
Have you heard that what's old saying called, it's better to let sleeping dogs lie? I learned that this weekend when I got out of my bed in the middle of the night to go to the bathroom, and I got back into my bed, and I guess I startled one of my dogs, and he bit my forehead. Yeah. And he's a very sweet dog. I don't think he ever woke up. He's a very sweet dog. He doesn't do stuff like that characteristically, but he sleeps very soundly. And if you startle him, he will bite you. So he just happened, I guess I had my head tucked into the pillow and he just turned around. Ah.
I think you're more accident prone than Dr. Tucker.
You know, we talked about that, and I think it's kind of a tie. Okay. So I want to go over something else too while we're on this chapter. Did you look over the case study about Nancy, the 67-year-old patient? Does anybody remember looking that over? It's in the blue box near the end of the chapter. It's on page 618.
The COPD patient.
And it asks you some questions about what you should ask Nancy. Did you go through those?
I did not, but I can now.
Want to take a minute to look at it?
Dr. Wheeler, I have a question.
Yes.
Okay, you said that you give supplemental oxygen when it's less than 91%, but I thought you stop treatment if it's less than 91%.
It probably, yeah, this is going to probably involve again, a consult with the physician. But in general, if it's less than 91%, you want to give supplemental oxygen.
Okay.
Did you hear that in a different class?
No, it's in the book.
Where? Show me, Bree.
It's on 613.
Where are you seeing that? What side of the page?
The right side in the little blue box.
Okay. Wait, there's not you mean a green box?
No, it's blue.
Box 38-2.
38-2. Okay. That's talking about, okay, it does say that and that, but I promise I didn't write this down, just dreaming of it, but it said somewhere in here 91%.
On page 615, there's a sentence that says a patient with a PO2 of less than 91% should not receive treatment.
Okay, okay, Bree, good catch then. So less than 91%, you don't even want to treat them. I misread that. If they're above 95, you're okay, but you may need to give supplemental oxygen. Okay, so does that clarify? That was a good catch, Phillips. Anybody else have any? Okay, so let's just take a minute, and I'm being a little more deliberate, but I feel like it may benefit you. I would like for you to look at the case study on page 618. Okay, and I'm going to mute myself for 2 or 3 minutes. I just want you to read through it. Or do I need to read it to you? Everybody have their book? Okay, all right. So just take a minute. Okay, are most of you through the first part? All right, so what do we want to ask Nancy? The 67-year-old patient with COPD. She's on a notice, a short-acting bronchodilator. That's her rescue inhaler. So you always want her to have it with her at the appointment in case you need it, right? Yeah. Okay, she's also taking a inhaled corticosteroid. So what do we know about steroids and inhalers? What do we want to advise the patient to do?
They need to
Rinse.
Yes.
Oh, sorry.
Rinse after using it. Okay. Now her vitals, her blood pressure is elevated. It's not really bad, but it's higher than it probably should be. Respiration is 17 and pulse ox 2, or pulse ox is 97%. She has loss of attachment, recession, and she drinks coffee and smokes. What is contributing to her COPD?
Smoking.
Smoking. What are we going to ask Nancy if she wants to do?
Quit.
Quit smoking. All right. Does she need a 6 to 9 month multiple antibiotic regimen?
No.
Nope. Because her COPD is caused by her smoking. So all we can do is ask her to cut down on that and live a healthier lifestyle. Okay, question 2. Which of the following treatment considerations is warranted based on Nancy's vital signs?
It would be the dietary and lifestyle recommendations.
Okay. And what else?
I'd probably also refer her to a physician to check her blood pressure.
Good. Okay. And she's at 97%. Do we maybe need to give her some oxygen?
No.
Probably
Just
not.
from 91 to 95.
Probably not. Okay. Do we need to refer to her physician for assessment? And you said yes on the blood pressure.
So what is the actual correct answer for 2, since B and D are both correct?
The tricky thing about this book, I think there's a lot of questions that are not one right answer. If they are, I can't find it. But if you,
Awesome.
if you stick with what we're talking about, I think you'll be okay. Now, use of ultrasonic instrumentation for Nancy's care is contraindicated because contaminated aerosols are produced by ultrasonic instruments and potentially aspirated. Is it absolutely contraindicated?
No.
No, especially if we want to use what? A piezo, right? Or even if it's not an older cabochon, you don't have to worry about it with the heart or the lungs. Okay, and what are we doing to keep our aerosols down?
High-speed suctions.
High-speed suction and sometimes two-handed dental hygiene. Okay, we also have cubicles, we're wearing face shields, and we're wearing our N95s. All right. After 20 minutes of treatment, Nancy begins to cough and wheeze, and she is unable to catch her breath. All of the following actions should be taken except what?
Does it administer oxygen?
Well, she's not able to breathe in very well, so I'm not sure that's going to be much help. But arguably, I would argue you could do all those things. You know, you don't want somebody dying in your office. So if you think you need to call 911, that's looking pretty serious, please do. Okay,
Is
want to use,
Dr. Wheeler,
yes,
is an upright chair position the same as like semi-supine?
no, semi-supine is about 45 degrees. Upright is sitting straight upright.
Okay, so would the best answer be that one?
Let me make sure I read this right. Yes, you would want her sitting up.
You do want an asthma patient sitting up all the way.
She's a COPD.
Oh,
Yeah.
yeah.
Yes, because it when you're laying on your back, your lungs can't expand fully. But when you sit up or if you lay on your stomach, they can. I learned that with the COVID, by the way.
With what?
My PCP told me that with COVID. He said if you lay down at night and you can't breathe, you need to sleep on your stomach.
And she's got a short-acting bronchodilator. Do you think we want to administer that? Yeah.
Yes.
Okay. All the following conditions Nancy is experiencing could be attributed to her respiratory medications, except which one?
D. I don't remember what the answer was.
What generally causes gingival enlargement?
Seizure medications.
Yeah, we've got
fentanyl.
It's phenytoin, warfarin, and then calcium channel blockers, right?
Okay, so she's not on any of those medications, or at least none were reported to us. So that's not going to be one of her problems. The others are. Okay, do you want
How does her medication cause elevated pulse? Like, why would that cause an elevated pulse?
corticosteroids can do that? Okay, that's why. She's on that shorty or that inhaled corticosteroid, and that can actually increase their pulse. Now we know.
Like, see that's in that table that's on 614 as one of the side effects.
Okay. All right. Okay, do you want to go through the review questions? Okay, I see one nod. Some of you look like you're about to nod off. Okay, let's try. The oral cavity harbors pathogens with potential to initiate a respiratory infection. Would you say that's true? Especially if you have perio. Yeah, it is true. All right. The majority of healthy individuals avoid developing respiratory infection by host defense mechanisms. Would you say that's true? Yes. Yes. Normal healthy patients can fight this off. Okay. 2, all of the common are symptoms of respiratory disease, except which one? Now we've got dyspnea, which is difficulty breathing, chest pain, bloody sputum, fever, and headache. And again, I think if you look back at that chart on 614, you'll see that bloody sputum is not included. It's sputum. There's a lot of mucus out there, but not blood. Okay. Now, on question 3, use of local anesthetics with sulfite preservatives, that's articaine or policaine, is preferred for patients with moderate to severe asthma because they're, I'm gonna stop there. It's preferred for moderate to severe asthma. Is that true? Do we want to use articaine and policaine, which have sulfites in it, on patients who have asthma?
No.
No. All right. And the second part of it is there's a greater possibility of allergic reaction to anesthetics without sulfites. Is that true? No, that is contrary to what we just said. Okay. Dental management for the patient with COPD includes all the following except which one? This is the one I had trouble with. And I think what it is supplemental oxygen for PO2 less than 91%. Because we really don't even want to treat them, do we? Okay, juniors, are you getting this? Is this helping at all?
I think this is the one that confuses me because the semi-supine is right there and it's with COPD.
Which, on question 4?
Yeah, so it says accept. So that means it's acceptable to do semi-supine chair position. But then for Nancy, it was sit her all the way up.
Yeah. Well,
So Nancy is just picky. I don't know.
no, it can be semi-supine or upright. And you have to go by what the patient says. You know how some of our patients come into the clinic and say, oh, I can't lean back that far.
Yeah.
Dizzy, because they have difficulty. But they can maybe tilt back just a little bit. But it can, it's varying degrees. How bad is their disease?
Yeah.
So I think the better answer, Peyton, is don't use it on the patient that's below 91% oxygenation.
Wouldn't it, Dr. Wheeler, wouldn't it be like, because of dental management for somebody with COPD, not for somebody that is having an attack? So does it mean when it says semi-supine, like don't lean them further than that, but when they're having an attack, sit them all the way upright?
I mean, they may be able to tolerate it for a while, and if they have a problem, they're going to have to come up.
Okay. Because that's what I understood from it, is just when we're treating them, we can't lay them all the way back. So it's saying just that's the maximum.
These patients are kind of unstable. This is chronic, so it can happen anytime. It can flare up. And so you just have to be ready for it, should it happen, and be prepared to act. Okay, let's go over the last one, which patients with a positive skin test for TB need follow-up tests to confirm the diagnosis and recommend the proper treatment regimen. Is that true? Yes. Now, treatment of TB with multiple medications for a minimum of 6 months is only necessary if active symptoms are present. Is that true? What do we treat latent TB with? Well, it's quite a few months to prevent it becoming active again, okay? So they're going to be on the long term, the 6 to 9 months. All right. I don't know if this is helping or not, you guys, but I'm trying everything. All right. Now I'm going to try to share my screen. I sure hope this works.
I just want to apologize to my group if I was wrong on all these. I'm sorry, guys.
That's all right. We'll get through it again. I'm just having trouble looking at my computer. All right. Let me try this first. Dagnabbit. I think I just kicked myself out. All right, let's try this way. And I'm going to go to, where is it? I've got it pulled up. Why don't I see it? Okay, I don't, that's not working for me. I was going to try to pull up the case study, so that you could look on it on the screen with me. But that's,
We saw it, Dr. Wheeler.
can you see it now?
No, not now. You stop sharing your screen. You just have to go back and share your screen like you did and just click the case study up at like on your tabs.
Okay. Well, now I don't see, oh. Can you see it now?
No.
No.
Okay.
I mean, if you make one of us the host, one of us can just share it.
Okay, why don't we do that? Let me see if I can get back to my Zoom without kicking myself out.
Hey, Dr. Wheeler.
Yeah.
I don't know what the problem is. I don't know if it's our apartment internet or what, but every time Montana and I tried to click on the like dentalcare.com case study, dentalcare.com just wouldn't work for us.
Okay.
So
Well, let's go over it together. Katie's got it pulled up. Is everybody seeing it? Yes?
Yes.
All right, so read this about this patient. 75-year-old Caucasian male who is a retired banker and remains active. What's so funny? Carly. Heron.
just laughing.
Okay. Because I'm reading, I'll just let you read this.
You got it.
Okay. He's an avid golfer and hiker, so he gets out and he does get some exercise. He has had extensive dental work done, and he's here for his regular maintenance appointment. He has palatal irritation due to an ill-fitting maxillary partial denture, and he knows that a new partial will need to be fabricated since previous suggestions have not been successful. Okay, now listen to this. He's had double bypass surgery 10 years ago and has encountered no complications since. Do we need to worry about pre-med? No, because he's normal now. He is taking metoprolol, which is what I take for high blood pressure, and pravastatin for high cholesterol. But he feels pretty healthy, and he gets out, plays golf, and hikes. So look at his blood pressure. That's pretty darn good. Respiration's good. Pulse is good. So we don't need to worry about pre-medding this guy. He's pretty stable right now. All right, so it tells us that the palate is inflamed and appears pale and hyperkeratotic. There's the bleeding index and the plaque score. Let's move to the next part, Katie. Shows his charts. His perio's pretty decent. He's got some 4s, but you know, that's not bad. 1-6 I saw. And this is his dental charting. All right, so he doesn't have any molars on the maxilla, so that's why he has a partial. He does have a fixed bridge in front. Okay, and we can see that the study model, looking at the full direct and the right side and left side, what angles class would you say this guy is?
I'd say he is a class 1 leaning towards a class 3.
Okay.
And it would posterior, bilateral crossbite.
I'd actually probably call him a 3, because if you look at the full mouth, the frontal side of this model, see how they are in crossbite in the anterior? That means he's like a bulldog, because he jutted out like that.
So you would agree that this is like the full length of a premolar then, which would actually send him to the class 3 rather than a tendency?
Yes, if you look on the right side and you look at the premolar or the mandibular molar, it's occluding mostly with what?
The premolar.
Premolar.
Second premolar.
So it's ahead of where that molar, that maxillary molar would be. So I'd call that 3. Now, same thing on the left side, the mandibular molar is occluding with the premolar. So again, I'd call that a 3. And then we've got that anterior crossbite, or end to end. It's hard to tell from the front molar. Okay, Katie, can we go to the next thing? Okay, here's his images, and you notice he's missing maxillary molars, and so he has this partial to replace that. Okay, and here's some intraoral photographs. You see there's some pretty good wear, probably because of his occlusion. And he has that fixed porcelain bridge, which is going to want to chew into his mandibular incisors. And then that palate looks really inflamed. And notice where it is. I think he has a horseshoe partially. And I can't point it out, but I can almost see the outline. Yes. Okay, thank you. The outline of that partial. It looks like a horseshoe partial. And normally on the maxilla, we like to have full coverage. It just sits better. It's more stable. Okay, is there anything else in that section, Katie?
No, that's it. Another reason you want the full coverage is for better suction, right? Because that's basically what holds it up.
Surface area and your saliva provide the tension for suction. Okay. Now remember, I think he had a dry mouth, didn't he? Did he have xerostomia here? Maybe not. I may be getting him mixed up with Nancy. Okay. Now let's go to the next section. All right. So vertical bite wing radiographs were exposed versus horizontal based on what justification? Tell me what you think it is.
D.
E.
I was thinking A because of missing teeth. So they would have something to hold on to.
I was gonna go D with alveolar bone.
With the increased visibility of alveolar bone, because normally we take verticals when we need to see the bone levels, or if we've got posterior crowns and we need to see the margins. Okay? Based on, we've already discussed this one. Oh, no, we didn't. AAP, I was thinking angles. AAP classification. You guys are going to know this better than I. What do you think?
B.
I thought it was
I put B.
yeah, B, stage 3, grade B.
Mm-hmm.
If I agree. Juniors, if you're like me, you're still learning this system. All right. Which of the following statements best describes the Furcation involvement on 2019?
C.
Yeah, see, I saw in his perio chart, it said he had a grade 2 Furcation, and that's the definition of that.
All right. Now on 4, the radiolucency surrounding the apex of the maxillary right lateral incisor illustrates the presence of what?
B. Bone loss.
Bone loss, yeah.
Can we go back and look at it, Katie?
Absolutely.
Let's see. Let me see 10. Okay, yeah, it looks like we've had a fair amount of bone loss on that too. It's kind of hard to see, but it looks like that root's almost floating. Would you agree? Okay, now I'm getting kind of seasick.
I have a question.
Yeah.
So it says maxillary right lateral. Is it the picture's right or the patient's right?
Yeah, I was using the other tooth.
Because I was using the right tooth.
Yeah, 10.
So just left of that, Katie. You're left of that. Yeah.
Yeah, 10.
See, it's kind of floating.
Okay. Yeah.
So, okay, this may be dumb, but my first instinct, I'm like, okay, radiolucency around the apex, abscess, and then
That wasn't an option.
Yeah, well, it wasn't an option. So when I see this with the patient, and obviously I don't have a multiple choice. I mean, of course, I'm going to consult with the dentist, but I don't want to sound incompetent when I'm presenting. I guess when I would be able to zoom in, would we be able to notice like some periodontal ligament not present? Is that the defining factor?
Katie, can you go around the radiolucency all the way around the root? Can you see it better now, Paige?
Yes, ma'am. I don't see any like the PDL, but it's also like really blurry for me. But
it's pretty.
Is that how I would notice?
Yeah, you would see like, whoa. And when you put your probe in, you're gonna go way down.
Okay.
Yeah, you're gonna see it better on a normal radiograph.
And I would know that it's not an abscess just based on the fact that there's no visible ligament.
Well, one thing, it's not confined to just the apex.
Okay. Oh, because it's hitting on the interproximal areas there.
All the way down. So that's
yeah. Okay.
All right. Back to questions, Katie. Okay. Based, we already said that it was a molar relationship is what? Well, we said angles 3, but that would be kind of an end to end. But there is a little bit, it looks like to me on the front image, it looks like crossbite, but on the side images, it look like an end to end. What do you guys think?
Do you want me to pull that back up?
If you want to, yeah.
I put end to end.
That's what I put. Yeah, end to end, because I looked at the molar.
Looks like it's a crossbite. But if you look at the right and left side, that looks end to end. So I'm going to go with end to end.
I'm sorry to go backwards, but I do kind of want to ask about on the last question for the perio charting. If we tooth number 10, right? Why wouldn't it show like a clinical attachment loss on the perio charting?
That's a good question.
So I was sort of like hesitant to choose that it was bone loss and not like a.
What are you maybe running into, Nikki, if you have that much bone loss when you're probing? What blocks you sometimes?
Calculus?
Calculus, yeah.
Okay.
But
let's remember we're looking at 7, not 10.
Oh,
you need to have some 4s.
Yeah.
You're right. I was backwards. Okay.
So, yeah, I did the same thing, Nikki. So don't feel bad. Okay.
I remember hearing 10, and I was like, "Wait a minute."
Yeah. Okay. Does that clarify that?
Yeah.
Okay. All right. Based on the patient's initial palatal intraoral image on the left, the dental hygienist should provide the patient with recommendations for his partial denture, including all of the following except. So let's look at for the exception. Well, we already said we think he needs a new partial, right? So we're going to rule out C. We do want him to daily remove the partial and clean it. What about the other two?
You don't want to use the alcohol based.
So we don't want to use alcohol because it'll dry it out, right?
Okay. Chemical and mechanical cleansers, those denture teeth are now called high impact resistant. They're pretty hard to damage. So we're probably not going to have any damage from any chemistry or mechanical. So I believe number A is right. Okay. 7, after discussing and reviewing the patient's brushing technique with his power toothbrush, what other home care recommendations would you make for him?
D.
Okay, that's a good one.
Wouldn't you not do stannous fluoride because of restorations?
No, that's APF.
Yeah. Yeah.
Thank you.
Yeah. That's a sigillated phosphate. That's when you have to be careful with the restorations. Okay, and we know that his oral medication, which I've already told you what it was for hypertension. This is a beta blocker. Okay, the best description for the patient's gingiva around the facial of number 22, and I'm going to say we may need to go back and look at the image. We're almost done, so don't give up. So we're looking for 22. What do you guys think?
I think it's festood because when I Googled it, it said it looked like a lifesaver,
Mhm.
and it looks like a lifesaver.
Okay. Anybody have a different opinion? Let's go back and look at the question. I'm going to agree with you. It's not really blunted, it's not stippled, but it doesn't look particularly fibrotic either. Okay, so his blood pressure was recorded at 120/82, according to the new American Heart Association's recommendations. How would you classify his blood pressure?
Would he be elevated just because of the diastolic 82?
I think so, but let me look over at my chart. Yes, slightly elevated because the cutoff is 80, 120/80. So his diastolic is up a little bit, okay? But not bad. That's pretty good for this guy. All right, now I want you to take just a couple of minutes. We're going to do one more breakout room. I want to get feedback on how we discussed this tonight, okay? So here we go. Right.
Well, my group voted that we loved this class session, Dr. Wheeler.
Okay.
Same.
I think there's a couple rooms that are maybe still open.
Dr. Wheeler, can you hear me?
Yes.
That tonight's case study on dental care, that wasn't an assignment, right? Like that was just a random one that we needed to do before this class.
Talk about it. No, it's not assigned.
Okay, are we gonna,
These can't be assigned.
what'd you say?
They cannot be assigned. when you go on there, when I log in to dentalcare.com, I can't assign case studies. I can just tell you to go look at a number such and such for a case study.
Hey, Dr. Wheeler.
Yes.
I checked my email and like my deleted items folder and everything. I never got the email that said to look at case study number 16. So I was wondering if you can like maybe send me like a test email to see if I'm getting your stuff or not, please.
Okay.
My email's always weird, but yeah.
Dr. Wheeler, I had a question. So when I was doing the assignments, at the bottom, you can say the assignment number to hopefully send it to you through dental care. It popped up green that said your assignment number is attached, but I just hope that.
Yeah, I've been getting double, so I'm
Have,
getting them.
so you have been, okay. I didn't know if that was actually sending it to you or what.
Yeah. In fact, I'm having a hard time keeping up with my email.
I'm saving my certificates just in case because I don't trust it.
Okay.
Yes.
But I have them all written down. They're on various pieces of paper on my desk. But some of you have finished, I think.
Yeah, I finished mine and I sent them. So I'm hoping that you got them.
Me too.
1, 2, 3, 4, 5, 6, 7, 8. Yep, sure did. Page.
Okay, good.
All right. So I just sent that test email.
I got it. Thank you.
Okay. I don't know why it didn't go through the other time. Okay.
My email's just weird.
Okay. Well, quick feedback. How was it tonight?
Our group
learned.
likes that we went over the questions.
Okay, so you like this version versus just staring at me on the screen.
I think groups too, because we can talk to a senior about what we may be confused about.
Okay. Well, I was hoping it would work that way. So did you feel like the breakout rooms worked pretty well?
It also seems like you're enjoying it a lot more.
You could have used a lot more what?
I was just gonna say you could use a little more time on the initial breakout room maybe. And somehow I think you just kept changing me to breakout rooms. So I kept getting kicked out and just into new ones.
Got kicked out, and then at first, one of the seniors had trouble getting in. So I don't know, we're dealing with all this technology that's supposed to be great, but sometimes I question how great it is. But anyway, we made it through. How's everybody feeling? Tired?
Dr. Wheeler, I have a question. It's just kind of a general question for clinic.
Okay.
I have a lady who's wanting to come get her teeth cleaned, but she just had her third, her wisdom teeth taken out yesterday. So when is the earliest that she can come get her teeth cleaned?
Did she have to have them surgically extracted or just removed?
She just told me she had them removed yesterday. She didn't say anything about surgery.
Well, you just may have to, if she has one area that's more tender than another, you just may have to be more gentle around that area.
It may be a good idea for her to go ahead and come because then she can irrigate it, right?
But on the other hand, if she just had it done, then we want to not wash out the blood clot. So really, we don't want to disturb that area too much. So
should I tell her like a week or two then, maybe?
About a week I'll do it, Selena.
In at least a week? Okay, I'll let her know then. Thank you.
All right.
Dr. Wheeler, real quick, for us that go to Head Start tomorrow, I was looking up the St. Augustine or something, and all I could find was a Catholic church. Like, I don't know if I'm looking wrong or what, but.
Here's the address. If you'll just program this in.
Okay.
1410 East 2nd Street, North Little Rock.
Okay. And we meet you there at the first location at 11:30, right?
Or you can ride with me when I leave the clinic.
Okay. Okay.
I'll be leaving the clinic at about 11.
Okay.
And then you come out and meet me. If you get there before I do, stay outside so you can help me carry this stuff in.
Okay, so go
Tomorrow,
to the clinic first.
so tomorrow it's Shelby, Sandy, and Jess, right?
Yeah.
Mm-hmm.
All right, yeah, you'll just meet me there about 11:30. And I think we might be going to Metro. Miss Barrow was supposed to confirm that for me, but I haven't heard from her. So, but I do have the woman from Head Start's phone number. I may just send her another confirmation in the morning, just to be sure. Okay. Rachel, who's sitting on your lap?
This is Kason.
Jason?
Hey.
Hi.
Wave at them. Say, how are you? How are you?
All right. How are you?
She said, how are you? How are you? Say, I'm good.
I'm ready. Are you guys? Yeah, okay. So if you have any questions, send me a text or email me. In other words, good night.
Bye.
Dr. Wheeler, I did have a quick question. Oh,
What?
Go first.
oh,
Okay.
okay. So, I was reading about beta blockers and they're for high blood pressure and also like an anxiety because they adrenaline. Wondering, if a patient had a fight or flight reaction, would they just like, oh, they wouldn't have the adrenaline, so would they not have that reaction?
Put them more in parasympathetic mode because they're beta blockers, and betas are stimulated during the fight or flight. So if you block that receptor, you do not get the fight or flight response. Okay. All right. Anything else?
Okay, Dr. Wheeler, I have a question. Okay, I was confused on number 3 on the case study in the book.
Yeah.
Because it said that the ultrasonic instrumentation would be a contraindication for Nancy because of the aerosols would be aspirated. And I thought it would be true because I thought you weren't supposed to do ultrasonic on people with respiratory problems because
it depends on the severity of their disease. And if you're using high speed evacuation, you're going to probably catch everything before it gets that far.
Okay. I just want to double check on that because I was confused.
Okay.
That's it.
All right. Anything else?
No. Goodbye.